A stroke is a sudden interruption in blood supply to our brain, and it requires immediate action. And knowing what you can do will truly save your life. So let's explore detailed steps to take in this critical situation.
Ever wondered how to survive a stroke when you are alone? Today, we will learn from the world-renowned professor of medicine, Dr. Alan Mandell. With over 7 million people following his medical advice across social media and a leading medical journal to his name, he continues to affect countless lives with his groundbreaking teachings. Today, he will tell us step-by-step process on how you can survive a stroke if you are alone. Ensure to watch till the end to miss nothing. Before we begin, let's take 1 minute to understand what a stroke is.
Your brain relies on a constant supply of oxygen-rich blood to function. And this blood flow brings essential nutrients and oxygen to your brain cells and removes waste products. When a stroke occurs, this blood supply is cut off. It causes the brain cells to begin dying within minutes.
Your brain doesn't have any backup reserves for energy. It relies completely on the blood flowing through your body to deliver a steady supply of oxygen, nutrients, and removal of waste products like carbon dioxide and toxins. If blood flow stops, these toxins quickly build up in your brain, and after about 5 minutes, the brain cells start to die. The longer the blood flow is blocked, the more cells are lost and the damage becomes permanent.
And strokes are broadly categorized into two types: ischemic and hemorrhagic. Ischemic strokes are the majority of strokes that we'll see, about 87% of all strokes. And it's caused by a blockage in the artery, often from a blood clot. And hemorrhagic strokes result from bleeding, either from a burst blood vessel or an aneurysm in the brain. And this bleeding can increase pressure within the skull and damage our brain tissue. Both types of strokes lead to rapid loss of brain functions controlled by the affected areas, which is why quick recognition and response are crucial.
An ischemic stroke happens when something blocks the blood vessels that carry oxygen to your brain. This blockage can happen because of blood clots, fat, and cholesterol build up inside your blood vessels, making it harder for blood to flow. A hemorrhagic stroke happens when a blood vessel in your brain bursts, causing blood to leak out into your brain tissue. This type of stroke is less common, but it's often more severe. 4 signs you are having a stroke. Face dropping.
Look in a mirror or use your phone's front camera to check your face. Smile or show your teeth. If one side droops, this could be a sign of a stroke. Touch your face to see if it's numb.
In face drooping, one side of your face suddenly looks lower or feels like it's not working properly. For example, if you smile, one side of your mouth might not move as much as the other. Or one cheek might feel heavy, like it's sagging. If one side of your face doesn't move like the other, it may be a sign of a stroke. Arm weakness.
Try to raise both arms at the same time. Count to 5 out loud. And while keeping them elevated, if one arm falls or cannot be lifted, this indicates weakness or numbness.
Your brain also controls the muscles in your arms and hands, allowing you to lift, hold, or move objects. If one arm suddenly feels weak or numb, it could mean the brain isn't able to control those muscles properly. This is when your arm feels heavy, like it's too tired to lift, even if you haven't done anything strenuous. Sometimes it might also feel numb, like pins and needles pricking you on that arm. If one arm feels weak, starts to drop, it may be a sign of a stroke. Speech difficulty.
Repeat a simple sentence, such as, "The sky is blue today." If your words are slurred or difficult to understand, or if you cannot repeat the sentence, this is a warning sign.
A stroke can make it hard to speak, understand others, or even think of the right words. You might notice your words come out slurred, like you're mumbling. It might also feel like your mouth isn't moving properly, or you can't form clear sounds. You can also ask someone you know if your words are slurred or hard to understand. If your words sound strange or speech feels hard, it's a clear sign of a stroke. Time.
For time, to call for help. Every second counts. Time lost is brain function lost. Use your phone's assistant or emergency features if you cannot dial the number manually.
If you have any of these symptoms, you're experiencing a stroke, and every second counts. A stroke cuts off oxygen to the brain, causing brain cells to die rapidly. The faster you get treatment, the better your chances of recovery. Use your phone's voice assistant if speaking is hard. Say something like, "Call 911." Or, if you're with someone, explain the symptoms to them so they can call for help. What to do if you have a stroke?
First, stay calm and focused. Take a deep breath. We know that stress exacerbates these symptoms, so focus on the next steps instead of dwelling on fear.
It's easy to panic when something like this happens, but stress can make the symptoms worse. Take a deep breath. Staying calm helps your brain and body function better. This will help you stay clear-headed and make better decisions. If you're with someone else, ask them to stay calm and help you through the process.
Second, call emergency services. Use voice activation features on your phone if you cannot use your hands well. Clearly mention stroke and your location.
Dial emergency services right away. If speaking is difficult, it's still important to try to communicate that you may be having a stroke and give your location. Even if you can't speak clearly, say the word stroke. It helps emergency respondents know what's going on before they arrive.
Third, prepare your environment. If possible, unlock the door to allow responders to give them that quick access so they can come in.
Try to make it easier for the emergency crew to get to you quickly. Move any objects or furniture out of the way so they can get to you faster. This small action can save precious minutes during a medical emergency, helping paramedics reach you without any obstacles.
Fourth, position yourself safely. Lie on your side with a pillow under your head to keep it slightly elevated. Avoid eating or drinking anything to prevent choking.
During a stroke, your swallowing reflex may be impaired, and drinking or eating could cause choking. So, do not eat or drink anything. If you're unable to lie down comfortably, try to remain as still as possible and avoid sudden movements.
Fifth, communicate your symptoms. If you can, write them down. Use a voice recorder, whatever it is. You need to communicate your symptoms and the time that they started. This information is critical for your medical team. And leverage technology where possible. Use smart home devices like Alexa or Google Assistant to notify a friend or a family member. Consider setting up an emergency app that can send out SOS messages to your location, to your pre-designed contacts at a push of a button. And once help arrives, clearly and slowly explain what happened and any pre-existing conditions or medications you're taking. This will aid them in providing the best care quickly.
If you can, try to write down or record your symptoms, as this will help medical professionals understand your condition. Write or record exactly what you're feeling, whether it's facial drooping, arm weakness, trouble speaking, or confusion. If you know any relevant medical information like allergies, medications you're on, or your medical history, make sure to mention it. This will help the doctors better assess your situation. If you're alone and need to wait for help, it's important to stay in one spot. Moving around could make things worse or cause a fall. If you're on the floor, try to stay in a comfortable position until help arrives. If you're in bed, try to avoid adjusting your position too much. Keeping still helps prevent additional injuries while waiting for medical professionals.
And it's important that for recovery and prevention, follow any medical instructions post-treatment diligently. This may include physical therapy, changing your diet, your medication. You want to engage in regular exercise. You want to eat a heart-healthy diet and manage your risk factors like high blood pressure, diabetes, or whatever it may be to reduce the chance of future strokes.
Have you experienced a stroke or know anyone who has experienced a stroke? Kindly let us know in the comments.